Just very briefly, about 2 years ago, the Center for Literacy, and I in particular, was contracted by the Memorial University group that does the online continuing medical education for the 17 medical schools of Canada to put together a course on health literacy, introducing, it was supposed to be physicians, nurses, and pharmacists at that time, and it was a combination of support that came, I think, from Health Canada, the Public Health Agency of Canada, Canadian Medical Association, Nurses Association, Pharmacists Association. And at the time when we talked about it, they said the only thing that they wanted was 1.5 hours, so it had to be an hour and a half, and they had already done a needs assessment about what it is doctors needed to know and wanted to know, and so in an hour and a half, we had to put together something that wasn't overwhelmingly heavy. What you're going to see today is the second iteration. It came down after a year because every course online has to be reaccredited by the college, by the Royal College, and I think the College of Family Physicians. And so after a year, you had to reaccredit it. But two things were extremely interesting when it came up for reaccreditation. One was that they had done an evaluation, and they came back and said they'd now like to expand it to be a 2-hour course instead of 1.5 hours. That's very big because they said the average length of course, the most popular courses don't go beyond 2 hours. Doctors don't want to spend more than 2 hours taking a course and getting the credit. The other thing was that it had to be very, very tight, very succinct, and as tightly linked as possible to practice. So it tried very hard not to get bogged down in a lot of text. And I have to say, for me, it was a huge learning experience. You notice we ended up calling it "You Talk to Your Patients, but Do They Understand?" the importance of health literacy in your practice. So it's very much focused on practice. And these ended up being the objectives. But the two things that got added this time that they had rejected 2 years ago, because I made a number of recommendations about what I thought should be in there, and of course they selected. They rejected a segment on cultural competence 2 years ago. They said they didn't need that. They had a separate course on cultural competence. They didn't want it here. And I had suggested that there should be something about the increasing use of the web. And they said they didn't want that either. I could do one page, one screen on the web, but no more than that. And this time, they asked for an entire segment. So there are 5 segments, and they don't look the same as last time. There's a whole segment on cultural competence. I have to say, it takes a long time for things to get out. This was done last July. The CMA launched the course a month ago, and it's available on the CMA website only to CMA members, and that's why I couldn't get into this, but if I had known you had access, I would have asked you to. It's also going to be launched as well on MDCME. Was supposed to already be up and should be up in the next week. Anybody is going to have access to that who wants it. Physicians and people in the medical professions can actually get a credit, but other people can do it and not get a credit. So it could have multiple uses. And I can't take you through the whole thing today, but I'll just show you some of what's in there. I think it plays out quite interestingly in terms of some of the conversations we've had. So we've talked about what is it you're going to be able to do, and you notice one of them in there is identify some of the barriers that may exist in your practice related to language, culture, reading information materials, and physical access. Identify challenges and opportunities presented by web-based information and media related to health literacy, and describe some practical things. So we're not going to go through screen by screen, but oh, see, I thought that it would do that. It wouldn't let me stay in. Sorry.
Can you share your password? We all have access.
No, you're not going to share my password. They're going to take it off anyway after this because they've just given me limited access, right, for today. Well, that didn't work somehow.
You push one more. Yeah, here's one. Yeah.
Oh.
No, say no.
Yeah, no.
No.
I know. Say no. Okay, just say no. So here's the introduction to the course, and this is where I guess what I tried to do was to link it as tightly as possible. Again, They wanted as much linking as possible to evidence-based, but they didn't want a lot of heavy text. So anything that takes people to external sources is over here on the side. You can follow up additional information, you can go to ask an expert, or you can ask for help. They also ask, interestingly, on the first module that we did 2 years ago, there was a pre-test and a post-test, and it had to do with people's knowledge. I have knowledge about this, or I understand what health literacy is. I know how to apply this. This time the entire pre-test and post-test was about confidence. I have the confidence that I understand health literacy. I have the confidence that I understand the cultural needs of my patients. So it's quite different just in that change. You notice we've linked it to communication, safety and risk, cultural competence, and health inequality. So all of the things that we've been talking about today, and quite clear that we haven't established causal pathways, but we have sufficient evidence to warrant specific changes in practice. So it's a kind of call to do that. I'm not going to take you all the way through, but the first one actually takes people through a background about how literacy definitions have evolved, what are the definitions we've been using over time, and there's a piece on Canadians and literacy that tracks the past 100 years, the evolution of the concept of literacy in Canada, which somebody may or may not be interested in, but it talks about how people, simply self-reported as being able to, can you read or write, and then how it became linked to the level of grade as a school completion as a proxy, et cetera, and then the development of the first test. And we do mention here that PIAC this year, as Scott noted, is the first, going to be the first international assessment that actually includes the way people operate in a technology-rich environment, which is, for all intents and purposes, online. So there's a definition from the IELTS of 2003 and a definition from PIAC as well, and they're quite different. And you'll notice that PIAC also doesn't, in the title, literacy doesn't appear. It's competencies. C stands for adult competencies, not for literacy. Literacy levels, again, these had to be taken from the 2003 level, and one of the things that we talk about in here is how the concept of health literacy has derived from those original studies, which is pretty much what we said. These were literacy levels. There's health literacy, evidence for health literacy. I'm going to just very quickly, Health literacy is related to, but not identical to general literacy. It goes back, talks about how it's evolved, and then talks about some of the populations who showed disproportionate negative outcomes on the scales, and these are the ones that we look at specifically when we go into cultural competencies. I think it was this morning that Lori talked about having to make everything very tight and very succinct. This is what has to be at the end of each of these segments, just a few takeaways. This is what we want you to take away, which we ended up calling clinical pearls, which is not unique to this. They use it in many places, but that was what they used. So literacy is no longer defined as an absolute condition based on context. Low literacy is strongly correlated to health status and outcomes. Health literacy is a broader concept in general. Health literacy is the use of a wide range of skills, et cetera, et cetera, et cetera. So I want to take us, I guess, to the units now. Let me just read my way down. There's a whole segment on communication strategies, which I'm not going to have time to look at, but I want to take us both to the cultural and age-related barriers, because these are the ones where we look specifically at particular groups. And I have to say that if I had heard the term cultural humility before this, I think I would have used cultural humility. So if we ever get to do another revision, it won't say cultural competency, it will say cultural humility. But so we've talked about cultural barriers here, and I think this relates to all the things that we heard you talk about. In fact, you're one of the people that I've cited repeatedly. We've also tried to draw on various either curricula or documents that have been developed in Canada Canada. There's something we didn't have access to 2 years ago. 2 years ago, almost all the materials that we had were from the States. And in the past 2 years, the numbers of materials that had been developed in Canada was quite large, many of them from here in BC. And so they're in this document as well. So, health literacy increasingly been tied to culture, language, and age, and evidence confirms that the capacity to access, understand, and apply it is as strongly influenced by cultural beliefs and practices, languages, and age as by levels of literacy. So, although some people might disagree with that statement. Oh, come on. Do I want to?
Yes.
Yes. Come on. Okay. So, there are a number of videos. What does that mean?
You want to do it?
No. I think I'm okay in going back because I don't want to. We looked at 3 groups in particular, and I think one of them that was of particular interest to me because it's a new area that we've been doing quite a lot of work in the past couple of years, is around minority language groups, and we specifically focused on providing health care to francophones outside of Quebec, which is an issue for francophone populations who live outside Quebec, because there's been an increasingly strong movement to give francophones access to schooling in their mother tongue and to health services where possible. And in many areas, one of the issues that's come up, and it's come up around the international assessments as well, is what language a minority language group chooses to do the assessment in. Well, it turns out that comes up around health care as well, because when we were doing the background work for this work, a number of francophone groups outside Quebec said, you forget that for a lot of francophones, their daily lives are actually, they play out in English. They're in English workplaces. So they may go home and speak French, and they may be giving their children French schooling, but they're working every day in a French environment and may be very much immersed in a culture that is English. And it may be that they're more familiar with health terminology that's English than French. So while saying that you want them to have access to health care in their mother tongue, it could well be that when it comes to providing health care, the language of health is not the language that they're most familiar with. And so there are sort of layer upon layer. And so one of the things we tried to do was just highlight that and say, so what is it? It's not just about translating, right? It's not about translating. By the way, this module has also been made available in French. It was not originally. And when we worked with Francophone colleagues to produce the French version, it was more than translation. It wasn't just translation. It was also looking at the areas where whole segments had to be adapted, where you had to use different references. All the videos are different because we needed to find videos in French that made sense in a French context. And it was quite an interesting challenge to do it. But the whole frame and the base of information is very much the same. That doesn't change. So again, we give a kind of background and then say, so what can you do if you work in a region? And we're saying, just know who the healthcare providers in your region might be, and we give them a reference. So you can actually click on this Société Santé en Français, and it will link you to networks to francophone providers in every province and territory. I've tried to be as practical and concrete as possible, not just say, so you can do this, but let us help you find a way to do this. We can help you. This is how you get there. This is who you need to contact. Connect with local French language organizations. Build a relationship with some francophone providers. When you stock information materials in your office, order French language versions when they're available, because certainly in Canada, many documents are available in French as well as in English, so you can do that. Again, we gave them reference to resources and also referred them to a curriculum that's been developed in French at Université de Moncton. Thank you. Okay. So let me take you. Okay, we're not going to go anywhere further there. Yeah. Let's see where else I can go. Immigrants. We looked at immigrants as well. Did the same thing, talked about the challenges. Many of them are the kinds of problems that you've highlighted. We used your work, we cited your work, but we also looked at a couple of actual interventions and research projects that had been done in Calgary and here in Vancouver, where materials were translated with the help of the community, culturally appropriate materials, and what the outcomes were, and people can go into those segments and actually play them play them out to see them. I wanted to flip to the web part. We have a whole segment on Aboriginal materials that we're very pleased with. A lot of the material there as well comes from BC. The web and health literacy. This was an interesting challenge because we studied some of the rate of internet use in Canada by age, and you'll notice that people over 75, this was last year's data, and may have gone up a little bit, but for people under 45, it was 94%, and for people over 75, 27%, and for that group, 64 to 74, 51%. But an increasing amount of information is being made available only on the web, so there are questions about who's being excluded, who isn't being reached, etc. There was also very much a feeling, certainly on the part of Health Canada, that they wanted to control where people got their information. And it was a little hard to be subversive, but I think a piece that I put in here was that you can't control information on the web. And so I think what I used in one of the things, Health Canada believes that its media resources is an effective source, but increasingly there is evidence that this is not the way people use the web. And I used a medical study that suggested that providers need to think about using the web to create conversations and blogs and establish relationships online with the patients and the clients that they're serving, and possibly even in terms of prevention. Again, what are we hoping? We're hoping it'll just open a whole new way of thinking about things. We put in a piece here about infographics. About using graphics to, when you do want to communicate material, about trying to present it in graphic ways, and showed an example from the Centre for Disease Control and another example that was created here in Canada. So we tried to, again, be as concrete as possible, give people, physicians as many guides as possible, and we've also given them some overview about what they can do for their own patients. There's a whole segment at the end about, so what can I do? And we're saying, just know something, get to know who your patient clients are, something about their education, something about their learning preferences. That's not something we've talked about today, but we said you can make small changes just in terms of some of your information on intake, and some of them can be both around education levels, but also how people like to learn. Because increasingly, we're going to have more and more control over the resources and the media that we have to make information and knowledge and interactions available to people, and there's no reason that we're not going to be able to make the match. So I'm probably going to stop there and just let people ask questions if they want to. I think we're quite pleased, and we're hoping that users will find it useful. We actually got very good reviews on the first one, but this one was actually more than a revision. It was almost a complete redo, and it was a redo. I was really heartened that doctors asked for it. Right? We didn't say, because they said no 2 years ago, and this time they came back. So what would I hope? I would hope that we'd move to a point where next time we actually develop a spin-off course, right, where all we do is work around web and the information and e-health, and do a whole 2-credit course just on that. Right? That's where I hope we're going with that. Also, would like to say to people, the center is doing its summer institute this year, learning from IELTS, preparing for PIAC, and as Scott mentioned before, the results are going to be out in October this year, but there is a whole segment on what they call problem-solving in technology-rich environments, which it has a very strong overlay with what's being called digital literacy in other cases. Lots and lots and lots of, never had data on this before, so it's going to be quite interesting. And 2 weeks ago, when I was doing a workshop somewhere on digital literacy, I had the title was Digital with a long line and then literacy, and it was like how much and digital divides. How much is digital and how much is literacy? And somebody in the workshop said, in a very short time, we're not going to use the term digital literacy at all, because literacy, it's going to be implicit. To be literate is going to mean you're digitally literate. So I think this is the place where we're going and how we're trying to integrate cultural concepts. Sorry, is that Irv? Are you doing the? Okay, Irv. Irv. Sorry, I'll moderate. Go ahead.
I think this is really great stuff, and I just wondered when
people other than doctors will have access to it?
It's a, it was supposed to already be up. Ironically, the difficulty has been around the use of French. It turns out that the Canadian Medical Association has had some difficulty getting up the French version. Their capacity to work in French is not strong. So we actually submitted this stuff last fall, right? This has been in their hands since last fall, and they were saying, we're being pressured. Health Canada is saying, where is it? Where is it? And so, well, here it is. And it didn't go up. Now, this one, I think, is a different platform, right? The one at Memorial is a different platform, but it also has to go up in English and French, and I think they're struggling a little bit with the French as well. That's malheureusement. Okay,
We had a lot of questions along
Yeah, I'm
the way.
sorry.
No, Sandy, go ahead.
Sandy.
Other people can go first.
No, but go ahead. No, that's not.
Okay. I know we were talking about the module development, and I know there's the fact development in this, and there's sustainability and redoing things and accreditation and with redoing content and ask the expert, and I know you had a lot to do with it. Are you the expert? Do you need to?
For the health literacy part, I'm not the expert for medical, right?
Okay.
So
All
any
the questions come directly to you?
questions
or-
come directly to me, except the questions in French get redirected to our colleagues in French, because I had French
it's a
colleagues.
team.
It's a team. We work as a team. We have a group that works together. I have a group of I call it health literacy consultants who work with me. Many of them are retired nurses. To be honest, a couple of people in public health, and so yeah, the questions come to us, and if we can't answer, then we pass them on to.
That's one of the challenges, I know, with a lot of these modules, is keeping that up to date, and that's one of the icons that
I mean, in disease areas, obviously, change happens very quickly, but it was very surprising in this one. There's been a lot of work done in the last 2 years, and one of the things we found last July was that in the previous, the number of articles on health literacy in PubMed had increased by 1,700 in 1 year. That's a lot of refereed articles on health literacy, right? Just in PubMed in 1 year. So, the increase was happening exponentially. So last July, there were about 4,700 articles, and 1,700 had been put up in the previous year. So that's quite a bit.
Okay, well, I'd like to thank all our presenters.